Hi guys, my name is Anne-Marie Ng. This is my recording for my Leadership and Management PowerPoint. I decided to do my PowerPoint on care delivery systems. The learning objectives for this assignment included to recognize several nurse care delivery models, understand the role of the RN in each care delivery model, and appreciate the advantages and disadvantages of each care delivery model. Course outcomes that were met included analyzing healthcare organizational structures, discussing healthcare economics and its management, discuss current issues of healthcare systems, discuss concepts to improve delivery of healthcare. An introduction to my presentation. Care delivery models describe the role of the nurse in providing patient care. Most relevant in the general context includes inpatient hospital care, but unique models exist for specific patient populations such as the elderly, disabled, mental health, and chronic conditions. The primary goal of care delivery models is to support the relationship that is built between the nurse and the patient. Patient care requires increased planning, interaction, and multi-professional collaboration. The four major care delivery models or systems that I decided to look at included the case method or total patient care method, functional nursing, team nursing, and primary nursing. Each model has its advantages and disadvantages. However, the effectiveness of each model depends on the specific setting it is used in, organizational goals, budget, and patient population. First method I'm going to talk about is the case method or total patient care method. This is the oldest delivery model where one nurse provides total care to one patient during the assigned period of time. It is still used in critical care units where a nurse will care for one or two critically ill patients. The care in this model is focused on providing complete physical and emotional support to one patient and their family during the shift. The nurse is responsible for all aspects of care, including technical treatment, assessment, teaching, and support. This nurse has no need to delegate care to other providers, and this nurse must be able to detect subtle changes in condition and respond with treatment. This little diagram here on the right is just a better way to help visualize the model itself. So as you can see in the middle, there's one patient, and you can have 3 nurses over a 24-hour period, all caring for the same patient on different shifts. The next model I will talk about is the functional nursing model. This model was developed during a nursing shortage during World War II and involves the care of a large unit or group of patients, and that is delegated to available RNs, LPNs, and UAPs, each of which perform specific tasks. Each nurse is assigned a specific task to perform on a unit or group of patients, like an assembly line of workers. These tasks may include treatment options or treatment procedures, admissions, and medication administration. Communication between team members in this functional nursing model is extremely critical. This model on the right here helps give an overview of how this functional nursing model works. You have the nurse manager who oversees who delegates to the LPNs, the LVNs, the nurses, and the nurse aides. Those 3 groups under the nurse manager are then assigned to a specific patient group. Team nursing is the third care delivery system I will talk about. This model was developed as well in times of nursing shortage and the need to use LPN and UAP, where care of a smaller number of patients is coordinated by the RN team leader. And there are several teams per unit. The team leader coordinates the care of a small group of patients among members of the team, several independent teams in each nursing unit. There are several independent teams in each nursing unit, so all patients are divided among these teams. The team leader delegates specific tasks to the RNs, the LPNs, and the UAPs, and the leader monitors the overall care of each patient on the team. So unlike the previous model, where there was only one assigned patient group for a set number of RNs, LPNs, and UAPs, the team nursing approach basically is the same thing, it's just divided into two teams. But in each team there's an RN leader, then consists of the RN, the LPNs, the UAPs, all overseeing an assigned patient group. Head oversight is seen by a nurse manager. This can be going on in 2 or 3 groups at a time. The last care delivery model I will talk about is primary nursing. This model evolved in the 1960s with a focus on individual rights. Each patient is assigned a primary nurse who is responsible for coordinating care throughout the patient's admission. The primary nurse coordinates, collaborates, and communicates all aspects of that patient's care with all other providers, whether it be other nurses, nurse practitioners, physicians, occupational therapists, physical therapists, etc. This nurse always provides care to the primary patient they have been assigned when on duty, but when off duty, they are able to delegate and coordinate care. This primary nurse develops care plans and monitors its progress throughout the patient's admission, and this nurse must have a broad knowledge to coordinate and assess all care needs of the patient. This, I would say, is probably the most similar to how we do nursing in hospitals today. The evidence-based practice behind these models. It is difficult to study the relative efficacy of each model and conclude that one is better than the others. Most evaluated studies lasted at least 1 year and compared nursing models with patient safety measures. And most studies did not find any significant difference, or no difference was sustained over the year of study. These next 2 slides are little tables that talk about the positive and negatives of each nurse delivery model. I will leave this up for a bit so we can look at it. I'll let you read it, but basically it has also a summary of what the nurse leader's role is, and as I mentioned, the positives and negatives. First up, we have the case method or total patient care method in the functional nursing model. You are also able to pause at any time. Next up, we have the team nursing model and the primary nursing model. Again, you are able to pause at any time to read through that. In conclusion, while there are 4 main care delivery models for acute inpatient nursing care, no one model has been shown to be consistently better than the others. Evidence-based analysis of care delivery models are inconclusive, and any early benefits are not sustained throughout the study. Lastly, the effectiveness of any care delivery model depends upon many factors, including the availability of RNs, LPNs, and UAPs, the skill sets of the RNs, including the nurse leaders involved in the patient care, organizational or the hospital budget and their goals, as well as patient mix and acuity. Thank you for watching and listening.